So good afternoon and welcome to today's lunch briefing on global governance of outbreaks from Ebola to the coronavirus. I'm Dan Graham. I'm the head of communications here at the Graduate Institute, and I'll be moderating today's session. The session will be presented by Dr. Suerie Moon. Dr. Moon is the co-director of the Graduate Institute's Global Health Center and is also a visiting lecturer in the interdisciplinary programs. She received her PhD from Harvard University. Dr. Moon seeks to combine academically rigorous research and analysis with policy relevance and impact. Her work is broadly concerned with the intersection of global governance and public health. Prior to joining the Graduate Institute in 2016, Dr. Moon was a lecturer on global health at the Harvard T.H. Chan School of Public Health. She was also the study director of the Harvard LSHTM Independent Panel on the Global Response to Ebola, which was one of the most critical reviews of the WHO's response to Ebola in West Africa. And finally, much of her work has been published in academic journals and covered in mainstream media. Now, before I hand it over to Dr. Moon, I'll just explain how lunch briefings work in case you're new to this. Basically, it's a 25 to 30-minute presentation followed by a Q&A session. If I can ask you to hold your questions off until that Q&A session, that would be great. We have people who'll hand you a microphone if you do have a question. So when you do get the microphone, if you could please say your name and the organization you work for, if that's relevant. And we'll try to get to as many questions as possible, but we are going to wrap up at 1:30 p.m. So thank you, and I'll hand it over to Dr. Moon. Thank you very much.
Good afternoon, everyone. It's a great pleasure and honor to be here. Thank you to Dan for the kind introduction, for all of you for giving up your lunch hour to spend time together with us. I wanted to first acknowledge that there are a number of experts. I can already see some friendly and familiar faces in the room. There's a lot of expertise here. I really look forward to engaging with you in the second half of the hour in a back and forth discussion and dialogue, and I hope that you'll jump right in. I also wanted to highlight that I am neither a medical doctor nor an epidemiologist. I'm a political scientist by training and a policy wonk by nature, which means that I'm really going to be focusing on the global governance questions, meaning what are the institutional arrangements that we have and that we don't have at the global level that help the global community to prepare and respond to outbreaks such as the novel coronavirus. Before diving into my presentation, I just wanted to take a moment to express my gratitude and my thanks to those who are working very hard night and day to control the coronavirus outbreak. Obviously, we're still in the midst of an emergency. This includes, of course, health workers who are on the front lines in China, such as Dr. Peng, who's pictured here. It also includes many who are not necessarily doctors or nurses, but who are working in the hospitals and clinics, people who are taking care of sick relatives at home, either because they have coronavirus or another disease, but they're not able to get access to medical care because the systems are heavily overwhelmed by cases. And of course, our colleagues up the hill at the World Health Organization, who I know have been working tirelessly night and day over the last 2 months to help to mobilize the most effective global response possible. We know that there have been already anywhere from 1,700 to 3,000 health worker infections and at least 5 deaths among health workers. So I just wanted to take a moment to really just recognize there are many people who've certainly taken risks greater than I have in this outbreak. A quick overview of my presentation. I'll begin with a brief introduction. Where are we today in terms of the outbreak? Talk about some of the key reforms that have been put in place since the West African Ebola crisis. I'd like to clarify that the Ebola in the title is not referring to the ongoing outbreak in the Democratic Republic of the Congo, but rather what happened about 5 years ago in West Africa. Then I'll look at persistent priority gaps in the global system, where is further attention needed, and then offer a few conclusions before opening up for Q&A and further discussion. So in terms of where we are today, this is the latest data from WHO as of yesterday. As we know, the numbers are changing on a daily basis. We have an estimated 72,000 confirmed cases and 1,850 deaths, including 1,800 new cases just in China as of yesterday, and approximately 800 cases in the rest of the world, covering 24 countries, and 3 deaths, including 110 new cases reported just yesterday. It's important to recall that of these 800, about 500 are coming from one place alone, which is the Diamond Princess cruise ship, including 99 of the 110 new cases reported yesterday. As with any new outbreak, especially when it involves a pathogen that has never been identified before, the biggest questions at the beginning and the most urgent thing is to try to answer unknowns. And there are many, many unknowns, certainly in the early days. We're only about 2 months into this outbreak. So what are some of the key uncertainties? I think one of the most important is transmission pathways. There has been a lot of research, and experts are working night and day to try to improve our understanding, but we still don't have, I would say, a solid understanding of exactly all of the ways in which the pathogen can be transmitted, and therefore what are the best preventive measures that can be put in place. We're still trying to understand better disease progression and severity, who is most likely to get disease, who's most likely to get severe disease or transition into critical condition, who is more likely to be immune. We understand that children, fortunately, seem to be less susceptible to severe disease, but a lot to be understood still. Related to this, of course, is what are the most effective and least restrictive preventive measures? Of course, we know today that there have been quite significant quarantines and travel restrictions put in place in Wuhan, Hubei province, around China. A number of countries have put in place travel restrictions, and airlines have decreased or entirely stopped flying into the country. But we really don't know what is the effect of these restrictions. How effective are they, and what is absolutely necessary to actually get the outbreak under control versus what is actually taking place. Linked to this degree of uncertainty, what are the most effective and safe treatment measures? And this is not just drugs and other kinds of treatment, but the kind of care that can be provided, for example, in an ICU in a hospital setting. And in terms of drug and vaccine candidates, for drugs, a small number of candidates have been identified, but there are a lot of unknowns in terms of course, their safety, their efficacy. They need to be tested in controlled clinical trials, how they will be produced, how much need there will be, and how much uptake there will be, and ultimately who will have access to drugs and vaccines that get developed. So I'll come back to some of these themes throughout my talk, but I think the key message I wanted to leave you with is there are many, many things we simply don't have a clear understanding of today, and that makes it extremely challenging, of course, to mount a response. Many of you may be aware that about 100 years ago we had probably the worst pandemic, at least in recent history, which was the great influenza pandemic of 1918-1919. An estimated 40 to 100 million people died worldwide, which is more than all of the deaths among civilians and militants in World War I. And of course, the big fear is that we will have something like this again. If we look at the last about 20 years or so, we've had a number of outbreaks, some of them from novel pathogens, some of them from identified pathogens that have perhaps changed in terms of their behavior. And what we see is, of course, if we go through the 4 quadrants, we see a number of different situations. So if a pathogen spreads slowly and has a low case fatality rate, it's not a major concern for public health. Of course, what we've seen is, in some cases, a relatively slow spreading pathogen with high case fatality rates. That was the case for avian influenza, H5N1. That's the case for Ebola. Or fast spreading with low case fatality rates. So that was the case for H1N1, the swine flu that many of you may remember from about 10 years ago, and measles. The big question, and what many people are most concerned about, is of course what might happen if we have a pathogen that fits into that 4th quadrant, where we have both a fast spreading pathogen and a high case fatality rate. And certainly we can say today that the coronavirus is a fast spreading pathogen, but exactly what the case fatality rate is, of course, remains to be estimated. There are some studies on this, but I think many would agree we don't yet have a totally clear picture. This is I think a very useful diagram that's been put together by the New York Times that both signals where does coronavirus sit in relation to other pathogens, but also highlights the degree of uncertainty. And I just want to caution that the y-axis here is on a logarithmic scale, so it looks a little bit more alarming than it might otherwise. So turning now to the global system and what has been done, particularly over the last 5 years. I would like to remind everyone that before the coronavirus hit the headlines, I would argue that the West African Ebola crisis probably was the worst public health emergency in recent memory in terms of the degree of global concern and panic that it caused. After this crisis was over, there were at least 45 studies that were done, post-mortem analyses of what went right, and of course, very importantly, what went wrong. And it was the last moment that the international community really tried to put in place in a concerted way reforms, new institutions, new measures to try to better prepare the world for future outbreaks. And that's why I'm looking back 5 years today. I think if you recall, the West African crisis affected 3 countries most badly. That was Sierra Leone, Guinea, and Liberia, which are 3 of the poorest countries in the world. They certainly had very under-resourced health systems. And so it's not surprising that many of the post-mortem analyses really emphasize the importance of strengthening national health systems, increasing investment and capacities in national health systems. And indeed, this is a requirement under the international health regulations, which are the main legal instrument that seeks to govern the global response to outbreaks today, also known as the IHR. The IHR, notably, were significantly revised in 2005, immediately as a response to the SARS outbreak of 2002-2003. And one of the requirements for all 196 parties to the IHR is that countries develop what we call core capacities, which means a health system's capacity to prevent, detect, and respond to outbreaks of infectious disease. One of the key reforms that was put in place after the West African crisis was a new, what I would call a peer review system, known as the joint external evaluation process, where countries help each other and they review each other's preparedness with the understanding that every single country relies on the strength of the health system of every other country when we're talking about outbreaks of infectious disease. So this was an important reform that was put in place quite recently. But what I want to highlight today is not just what happens at national action, but of course, what needs to happen at the global level. And if you look at the next circle, the global safety net, as I refer to it, this was very, very important during the Ebola outbreak, because as I mentioned before, we had countries with heavily under-resourced health systems. And so it was important that the global community offered financial assistance, technical assistance, operational assistance on the ground, and that is certainly what happened. And this involved, of course, governments, WHO, oftentimes militaries, non-state actors such as NGOs, foundations, private firms, et cetera. There was a huge upsurge of response, forming a effective global safety net. And a lot of the recommendations, again, post-West African crisis, looked also at this global safety net. What I'd like to do is to draw a third distinction, call your attention to a third level, which is what needs to happen at the global level beyond the safety net function. So even if countries have in place all of their core capacities, what is it that needs to happen inherently at the international level? And these are really some of the key global governance challenges that I'd like to highlight for you today. So if you'll engage briefly with me in a thought experiment, imagine that all 196 countries that are party to the IHR, and even everybody else, had full core capacities. They were perfectly prepared for an outbreak. And I'd like to highlight that, of course, this is not realistic, and that even in the wealthiest countries in the world with the most sophisticated health systems, we're not ready to respond to outbreaks. And we've seen this. The US struggled very heavily to respond to a few cases of Ebola. We see that South Korea, for example, struggled very much to respond to MERS just a couple of years ago. So it's not only about the amount of resources that a country has. But let's imagine that we live in a world in which every single country is perfectly prepared. What is there left to do at the global level? And these are really where some of the key global governance functions, as I would call them, come into place. I think you can divide these into 3 different categories. So some have to do with the international health regulations. Some have to do with the need for research and information sharing across countries, across borders. And then lastly, looking at the WHO, the UN, and the global system at large. If we look at the international health regulations, one of the things the IHR tries to do is to get countries to rapidly report suspected outbreaks. And we have to recall that this is a function both of capacity to conduct surveillance, to identify when an unusual disease event occurs, as well as the willingness to share that information quickly, either with WHO and or with the broader international community in some sort of public manner. Linked to this is the need to have science-based trade and travel restrictions. And I'd like to highlight that the two of these are really interconnected. And so this is really the bargain that is encapsulated in the IHR. The idea is that countries should come forward more quickly and be willing to share information about outbreaks, with the understanding that unaffected countries or countries that are not yet affected will not overreact and will not put in place travel and trade restrictions that would cause severe economic and political harm to the country that's directly affected. This is really the quid pro quo, the key bargain that I think is encapsulated in the IHR, and this is, of course, something that needs to be done at the international level. We know from the outbreak today and many previous outbreaks, this is really challenging to implement in practice. But I'd like to highlight that a number of the economic repercussions, and we see today many, many economic repercussions from coronavirus, they're linked to the trade and travel restrictions even more than from the direct health impacts of a pathogen. Finally, one of the important functions, of course, at the international level is that you need some body to adjudicate and to make a judgment call and say, when is this really an emergency that requires a much higher and more intense level of international mobilization? And this is, of course, a responsibility that has been mandated to WHO through its power to declare an emergency, the Director General's power to declare an emergency, referred to as a public health emergency of international concern. So all of these three functions, even in the most perfectly prepared, if all countries are perfectly prepared, we would still need arrangements to make sure that these things happen. When we shift gears and move into research and information sharing, I'm going to go relatively quickly here. But of course, no matter, again, how well a country is doing, we need countries to rapidly share basic epidemiological data. Countries need to share information about what is happening in the healthcare setting, clinical information, and of course, once drugs or vaccines begin to be tested, clinical trial data. Genomic sequencing data, which allows scientists to track, to identify a virus, to identify if it's mutating and changing in important ways, to develop countermeasures such as diagnostics, drugs, and vaccines to address any new pathogen. And this is also where, of course, pathogen samples, meaning literally the blood or other fluids that might be coming from a patient, we need to find good systems, of course, to share these internationally. And very, very closely linked to the issue of sharing pathogen samples is the issue of who gets access to drugs, vaccines, diagnostics, and other countermeasures, particularly when the entire world is in panic. We already know that face masks, for example, are in short supply, certainly within China, also outside of China. You can imagine what will happen if the outbreak grows more quickly and we find effective treatments effective products to treat or prevent the disease. Very, very difficult situation to govern. Last but not least, it's of course important that in an era in which information moves across the globe instantly, we need to have good methods for mobilizing the public and to communicate clear messages to communities and to the public. If there was one key lesson that really came out of the West African crisis, it's that what broke the back of the epidemic, what really turned things around, was changing of behaviors on the part of community members. So it wasn't necessarily the huge, sophisticated medical operation that was launched, although that was, of course, very important. But in terms of breaking chains of transmission, it really was figuring out how to actually build trust with community members, share information on how behaviors could change so that transmission would stop. And this is an area where international cooperation is absolutely essential. Turning finally to WHO, UN, and the global system, we need, of course, a WHO that has the capacity to put boots on the ground, that understands how outbreaks behave, what I would call operational capacities. If we look more at the institutional level, we also need a WHO that is adequately financed in a stable way, and that also has effective governance and accountability mechanisms. Looking across the UN system, of course, many health crises often require the involvement of many other UN agencies. They don't remain health crises for very long. That was certainly the case during the West African crisis, and I would argue already the case today with the coronavirus outbreak. And so UN coordination remains very important, as does global financing. And of course, we know that even if, again, all countries had enough money to fund national responses, which is not the case today, we would still need global financing, for example, to develop public goods such as, to do research, to develop public goods such as drugs and vaccines, et cetera. And of course, global system-wide accountability. I mentioned earlier that we had a number of non-state actors as well as state actors responding to the West African outbreak. We also see that currently with the coronavirus outbreak. Many, many actors mobilizing to lend a hand, but actually very weak mechanisms until recently to try to ensure there's accountability across all of these actors. So these are all functions that need to be performed at the global level, but I think that in general, as is often the case, arrangements at the international level tend to be thinner, lighter, weaker, more fragile than at the national level. The other thing to highlight is that, of course, generals are always preparing to fight the last war, and I think this proverb applies as much to outbreaks as it does to armed conflicts. I think a few things are worth highlighting about the coronavirus outbreak that we are in the midst of today, and this is really unprecedented in many ways. So first, the scale of the containment measures. By one estimate, at least 150 million people under some kind of restriction on their movement within China. This is really, in modern times, I think, a massive experiment, and then it still remains to be seen what exactly will be the outcome. The scale and interconnection of China's economy. So we're talking about a country that is now has the second largest economy in the world, deeply integrated in the global economy, and already having repercussions on questions such as medicine supply here in Europe, iPhones, manufacturing of automobiles, manufacturing of medical devices such as masks, et cetera. So I'm going to try to, I'm not very good at clicking. Let me just show you one thing. I haven't yet seen any good estimates of what are the economic impacts. These are some of the numbers that came from the SARS outbreak, and I think it's clear. You see a number of the countries. SARS was probably the costliest outbreak over the last 20 years in terms of direct economic impacts. You see a percentage of GDP loss and billions of dollars. I'm quite convinced that coronavirus will be at least an order of magnitude higher than this, if not more, but we just don't know yet. In terms of the geopolitical situation, of course, I don't need to remind all of you in the room we're in a time of transition. China is a rising power. We're shifting in terms of the global political system away from a unipolar system, as we say in political science, where the US has been the sole superpower since the end of the Cold War. With China rising in economic, political, and military influence, there has been, of course, a lot of tension highlighted, for example, in the US-China trade war. But not only. And many countries, of course, are also trying to figure out how do they reposition themselves in a time of tremendous geopolitical change. And this is really unprecedented and leads to a hyper-politicized atmosphere within which we're seeing responses to this outbreak, where it becomes difficult to discern when are measures taken by governments or other actors purely out of public health or scientific concerns, and when are they, in fact, politically influenced. It becomes very, very difficult to tell the difference. We're also operating in an environment in which social media is, of course, even more prominent than it was 5 years ago, the flow of misinformation in social media, and record levels of mistrust or low levels of trust in authority. And of course, sources of authority are very important when trying to combat an outbreak. Edelman, which does a survey every year on global levels of trust, published maybe about 3 or 4 weeks ago, their findings for 2020, finding that, in fact, government is considered less competent and unethical, media not too far behind, business competent but not ethical, NGOs ethical but not competent. Edelman's findings, not mine. And of course, what you need to respond to an outbreak is actors who are considered both competent, they know what they're talking about, they know what they're doing, and trusted, and ethical, doing the right thing on behalf of people. I think it's also interesting to point out that in terms of who has the greatest mistrust or the lowest levels of trust, I would say, in traditional sources of authority, there is a record level of inequality according to the Edelman study. Now, what you see at the top is the degree of trust in 2019 among the informed public. This refers to about 17% of the population in a country, the elites, and probably it's safe to say many of us in this room might count as the elites in our own countries. And 83% is considered mass population, and you can see that gap has grown significantly. Obviously, this is not only about disease outbreaks, about much deeper changes in the economy and societies and politics over the last decade or so. But just to highlight how difficult it is to mount an effective response in this kind of environment. Last but not least, and on a more positive note, I want to highlight that we are also living in a time of course, unprecedented advances in science. And what I mean by that is not only the technological aspects. Of course, it's amazing how quickly scientists can map the genome, for example, of this new virus, develop new technologies. We expect a first vaccine candidate in 16 weeks, which is unheard of. But also in the financing. And so we have the creation of the Coalition for Epidemic Preparedness, which was a global research and development fund created in the aftermath of the West African Ebola crisis, precisely to feed money very quickly into the R&D system to develop vaccines. Not necessarily drugs, diagnostics, or other technologies, but vaccines. But this is an important advance, and this is the reason why there are already a number of projects underway for vaccines. On governance, I also think that it's very important, for example, that WHO called together about over 300 scientists just last week here in Geneva to try to mobilize all of the knowledge and expertise in the world to try to advance our understanding as quickly as possible. Scientists are collaborating with each other. They are sharing information. They're pre-publishing their findings before journals will formally publish them. I think the WHO has set priorities in terms of what are the priorities for investment in R&D. Funders say we are willing to follow these priorities. So these are all very, very significant advances that certainly this was not the situation 5 years ago. So on the scientific side, I think there's a lot of good news. But we have to remember, of course, in the DRC Ebola outbreak, we now have an effective vaccine. Having science and effective vaccines is certainly not enough. That outbreak continues to simmer on, partly because people don't necessarily trust the authorities. They don't want to come forward to get immunized. So this remains a major concern. Where are there gaps in the system? And this is really my judgment of what do I think the priorities are today. And when I say today, I mean February 19th, 2020. In the midst of an outbreak. I think we still need to keep a very close eye on what's happening with trade and travel restrictions to understand how can they be implemented so they're effective, but they don't unduly violate the human rights of individuals who are directly affected by them. Research and information sharing, absolutely essential. Countries need to continuously share as quickly as possible information across a very, very broad spectrum. And I think we're doing imperfectly, to say the least, in this regard. When it comes to WHO, UN, and the global system, major gaps in terms of financing. Everybody said we need reliable financing for outbreak preparedness at national and international level post-West African crisis, but very few instruments were put in place to do that. One of the instruments that was put in place to do that is called the contingency fund that WHO is able to tap into. According to the latest numbers I saw this morning, I don't know exactly what the balance is in that fund, but it's never been fully funded at the $100 million level that WHO has asked for. I think it might be down to as low as 10 million. WHO just dispersed 10 million to a number of countries to help prepare for coronavirus. So the fact that we don't actually have reliable pre-existing financing measures in place is shocking to me and remains a major consideration. In terms of what are the priorities post-crisis, and I do believe there will be a post-crisis, although I couldn't tell you when that will be, I think there will be a need to really revisit the international health regulations. And this is a big contrast to what was happening 5 years ago, where I think many of the legal experts said the IHR did what they needed to do during Ebola. The problem was that countries didn't comply with their obligations. And I think we hear a change in attitude in the coronavirus outbreak. There was, of course, just an event 1 or 2 weeks ago of the Lancet Commission on Global Health Law, where a number of experts, some of whom I think are here in the room, highlighted that coronavirus has reminded us that there may be a need to really go back, reopen the IHR, or at least to find other ways to make it more fit for purpose. And I think this is something that we'll see again in the post-crisis period. In terms of research and information sharing, I think there will be an urgent need to address this issue of how to convince countries to rapidly share samples of pathogens with the international scientific community, and how to put in place effective arrangements so that countries can expect and reliably expect that they will get access to drugs, vaccines, and diagnostics when they need it, even in the heat of a crisis. We have managed to do this for pandemic influenza, but we've not managed to do it for any other pathogen, and I think this will remain a priority post-crisis. And of course, public mobilization and communication strategies will continue to be a major challenge, especially as I'm not sure that some of the deep underlying reasons why we have growing levels of mistrust in society, I don't think those are going to be addressed in the immediate future. When it comes to the global system, I would really underscore again, financing. This problem is not going to go away. WHO remains a very precariously financed organization. This is something that experts have pointed out for decades, and yet there's been very little progress in actually addressing that. So just to now conclude with three overarching conclusions that I'd like to leave you with. One is a positive and an optimistic message, which is that there have been many significant reforms put in place after the West African Ebola crisis among scientific researchers at WHO in terms of financing mechanisms being put in place, the appreciation for the importance of public communication and mobilization. There have been many, many very significant efforts, and I want to not I want to fully recognize the importance of those changes. At the same time, there are at least 4 areas that I would personally consider to have had inadequate attention. The first of these is better managing trade and travel restrictions, with a reminder again, this is where the majority of the economic impact comes from. Improving how we deal with public communication and how we try to address issues of trust. Ensuring access to drugs and vaccines in countries that may not have the R&D or production capacity. And of course, this relates, as I said earlier, to the issue of pathogen samples. And then finally, financing not only the national health systems or the global health system, but also research and development, outside the area of vaccines. The last conclusion I'd like to leave you with is that outbreaks are expected to become more frequent, and there's a lot of reasons behind that, including urbanization, increased travel, increased interaction between humans and animals, whether wildlife or domestically raised. And so this leap of pathogens from animals to humans is expected to be we'll see crises like this, I think, more regularly. At the same time, it's unpredictable. We don't know, and nobody, I think, could have predicted with accuracy that this particular coronavirus outbreak would make that leap begin to spread quickly in Wuhan. At the same time, each of these are also unique. If we think about the major differences between coronavirus, DRC and Ebola, Ebola and DRC, measles and DRC, Ebola in West Africa, MERS, SARS, every single crisis has been very, very different. And so I think what this means is that what we need at the global level are both flexible and resilient arrangements, and to make the investments as much as possible in peacetime, as we call it, in preparedness. So with that, I thank you. Merci, 谢谢. And I look forward to questions and comments and engaging in a discussion with everybody.
Thank you very much for that very interesting presentation, Dr. Moon. This is now the question and answer time, so I just wanted to see if anyone has any questions. If you do, just please raise your hand and we'll make sure we get a microphone for you. We have a microphone's coming. We have a woman here in the 5th row. Okay.
Thank you very much. It was really interesting and really important discussion. And I have a question regarding the research and information sharing. You talk about the importance of sequencing data. But at the same time, there is the Nagoya Protocol. So I wonder, maybe you can develop how Nagoya Protocol and this sequencing data sharing could get along. Thank you.
Want to take a few?
We can go one-on-one, I think. Yeah. So if you want to answer that one, that's fine.
Take that one?
Yeah.
Oh, okay. Sorry. So I'm really glad you raised that question, and in fact we have a 2-year research project ongoing on the issue of pathogen and benefit sharing together with Gianluca Berci, who is my collaborator here at the Institute. And I think, my personal view is that the Nagoya Protocol, in fact, can play a useful role in trying to ensure that there are access to benefits that are related to pathogen sharing. What we haven't yet figured out is how to ensure that countries, in fact, have the incentives to share pathogens quickly, that they have assurance or security that they will have access to potentially a wide range of benefits as a result. And I think one of the tricky things in terms of outbreak response is that we're not only talking about a bilateral arrangement where I share a pathogen with Dan and in exchange he gives me drugs. In an outbreak like this, we need pathogens to be shared rapidly with the entire global scientific community, and we need benefits, including research findings, including diagnostic reagents and tests, drugs, etc., to be available to every single country where populations might be at risk. And of course, one of the big challenges that I wanted to highlight is that we don't yet have any clear guidance or systems to prioritize, because we know that if a effective health product is developed, of course, at least in the early days, there's going to be a limited supply of those. And so the question of, who really should get priority access to those products, it's a very, very difficult ethical question. And I think it's not one that we have made enough progress on, certainly since the West African outbreak. This was a problem during the West African crisis, but it's one that I think is so politically difficult that we have been we as a global community perhaps have been a bit hesitant to touch it.
I saw 3 hands go up in the last row, and the order was, I believe, the woman, behind the gentleman in green. Can't see what color you're wearing, sorry. And then we have the gentleman in the light blue blazer, and then the woman with the gray scarf. We'll get to you. Thanks.
Great. Hello, my name is Devi from FIND, and I had a question related to financing for pandemic preparedness and response. So there is, from my understanding, the World Bank has the PEF, and I'm curious on your thoughts on how it was used during Ebola, both the West African outbreak and the current outbreak in DRC. How is it being used, or if it's being used in this current outbreak, and perhaps your thoughts on the effectiveness of it for response and preparedness.
So the PEF that you mentioned, I think, was one of the efforts to address this problem of having inadequate financing, right when an emergency strikes. In my view, it has proven itself to be much less sensitive and responsive than it needed to be to the need for funding. And the whole idea behind the PEF was that you would have rapid disbursement of funds. I think this is one of the challenges around when I say each outbreak is unique and it's impossible to predict, how will the characteristics of coronavirus differ from Ebola in DRC, from Ebola in West Africa, et cetera, so that the triggers that were put in place for disbursement of funds from the PEF don't actually match the outbreaks that we've seen in the years since it was created. I do think there's a need to take a hard look at redesigning the PEF possibly, but also to look far beyond that. It's a relatively small fund. I think the idea was to try to do something very sophisticated with investors, and I think it just hasn't really panned out, to be honest. But I think the need for addressing the financing gaps in a more sustainable, predictable, and flexible way that's an urgent need today, and it's an urgent need tomorrow. So the issue is not going away.
Great, thank you for that question. And yes, we have the gentleman in the blue jacket.
Thanks so much, Professor. I have a question on would you think the global system, particularly in its legal instrument, would redefine the borders between protection of the public and individual rights? Particularly in light of the coronavirus, we see that 150 million people have some restriction of sort within the borders of China, at the sea, and other countries. Do you think there would be a revision under the existing legal systems, or the question will be raised in general as a response in the global system?
I'm not sure I fully caught the question. You mean assessing the adequacy of national legal systems?
It's basically defining the borders when you have the right to protect the public and restrict the individual rights by enforcing a curfew or restriction of movement within countries, or having massive quarantine measures at the sea, for example.
In terms of some of the quarantines that have been put in place, and I think, I'm certainly not an expert on quarantines. I think there is a massive challenge with what is truly an evidence-based travel restriction. And I think this has become much clearer in the coronavirus outbreak. During the Ebola outbreak, it was possible to say with a lot of certainty that we know how Ebola is transmitted. Of course, Ebola is also a pathogen that was identified in the 1970s, so we had a fair amount of scientific understanding about it. And it was easy to relatively easy, I would say, to control. You could identify people who would be, who were symptomatic if they were to get on an airplane, that sort of thing. With the coronavirus, it's very different. And we, as I said, we don't know, for example, the possibility that people who don't display any symptoms might be able to transmit the virus remains a possibility. We don't know that for sure. But it's not a question that's been adequately answered by science. And so in a situation of so much uncertainty, it's also very difficult to know what are the kinds of travel restrictions that will, again, be effective without unduly denying people their rights to liberty, to free movement, et cetera. And of course, if we look at what's happening on the Diamond Princess cruise ship, I think this has been a big surprise for many, certainly many public health authorities who hoped that by quarantining the ship you would restrict spread. And of course, what seems to have happened is that you've had massive transmission on the ship instead. So I do think that it's an urgent area to continue to scrutinize and to try to change and adopt the guidance as we understand more about the pathogen. But I don't feel that I personally have enough understanding of the situation to say travel restriction X is justified and Y is not. And I think this is one of the big challenges. Nor can I say travel restriction A is politically motivated or travel restriction B is purely based on public health concerns. There's a lot of uncertainty for me and I think for many others.
Go ahead.
Who do you think is leading the outbreak, the political response to the outbreak? There's a lot of criticism that WHO was perhaps too soon in its efforts to praise China, but it's hard to read. We know that WHO is delivering on the technical issues, but there's a lot of what seems like a motivated sort of questions on whether China is doing the right thing. How do we read that without the, no questions about the technical aspects of it, but it seems to be also politically driven?
I think as many of you are, of course, very aware, WHO is a member state funded, governed, it's a member state organization. And so it's always going to be having to respond to concerns of various member states, including, of course, China, but also its other 193 member states. And I think this is, from my perspective, the most important priority of WHO in this outbreak is to try to get the outbreak under control, of course, to try to make sure that people who are already infected get the best possible care, and that there are a number of political considerations that I imagine, I don't know, but I imagine went through the Director General's mind in trying to decide how do I position WHO in the midst of this outbreak. I think one of the most important things, as I was emphasizing earlier, is to try to ensure free flow of information, that there's rapid sharing of epidemiological and clinical data. This is both, of course, from within China, where you've had 99% of cases, but also many other countries that are experiencing cases. And I think WHO has struggled actually to get all of the information that it needs as quickly as possible. But if the priority is really to get the outbreak under control, then I think it's fully understandable, and I actually think the Director General had to make a political decision. How am I going to manage this relationship with my member states, with the government of China in particular, to try to make it a cooperative relationship, to keep information flowing, to keep collaboration moving forward, rather than, let's say, being a commentator on the state of outbreak response. Those of us who don't have those kinds of responsibilities, who are not the Director General of WHO, can speak in a different way. But I do think the single most important thing that the organization had to do and still has to do is to try to get all of the stakeholders, including all governments, on board to share information, to collaborate, to really get this crisis under control. And it remains, I think, very much an emergency situation.
Saw two hands go up in the third row. There was, it was you, and then there was the gentleman in the back. So we have the woman right here in the dark dress, and we have the gentleman behind her after.
My question is related to the sharing of pathogens. I'm thinking, if we're talking about the Nagoya Protocol, there are some beliefs that it could be a burden when sharing the pathogen becomes crucial, for example, in the case of an outbreak, and we need to really share the pathogens very quickly. Do you think it is a burden, or you think it's more useful?
I think what we see, and just to take a step back and perhaps explain a little bit what is the Nagoya Protocol, because it's now the second question on this issue. We have the Convention on Biological Diversity from the 1980s, if I remember correctly, which tried to ensure fair access to genetic resources and the sharing of benefits related to those genetic resources. And this really came out of the environmental community, and it was a reaction against fears around biopiracy, for example. Nagoya Protocol was negotiated as a follow-up to the Convention on Biological Diversity because of concerns that the CBD actually wasn't detailed enough or didn't have enough teeth, wasn't effective actually in addressing these concerns. And what we see today is that a number of countries have now begun to implement the Nagoya Protocol into their national law, and there is concern that in this process of implementation, countries will there will be delays within countries with sharing genetic resources such as pathogen samples internationally because of concerns that they are not being shared in a way that will result in fair access to benefits. This is really, it's kind of the background on Nagoya. I think it remains to be seen. We're in early days with countries actually implementing at national level. There's not a lot of great data out there on exactly what is happening with pathogen samples and what role is national implementation of Nagoya playing. But regardless of the national implementation of Nagoya, I do think that there is absolutely a need internationally to address this issue. And part of it comes from the pressure being put on the system by the fact that Nagoya is increasingly implemented. I think it can be a good pressure because it can be a good political pressure to get governments together and say, we have to address the problem that we don't actually have clear norms and systems and arrangements in place for the sharing, reliable, rapid sharing of pathogens and reliable, rapid sharing of benefits. And I think the big problem is that there is a near vacuum at the international level in terms of what are the norms and the practices, what is expected of member states, of governments in doing this. So me personally, I don't think that Nagoya is necessarily a block, doesn't have to be a block. I understand why there are concerns raised by it, but I do think that the bigger question is a broader question around pathogen and benefit sharing, with Nagoya being one piece of the puzzle.
And we have the gentleman in the fourth row.
Thank you. You've been answering part of my first point, which is my question would be on this entire second area that you delineated of research, information sharing. Where are the gaps in governance, and which governance improvements could you think of for that particular area? And my second point is that you've been sort of talking about financing preparedness and response. And to me, those are two different questions. I guess we can calculate whatever we would need for preparedness. Much more difficult for response. And if you look at HIV or at Ebola, the financing for the response came when a certain threshold of threat to security was reached. Would you agree with that?
Absolutely. I think let me take the second question first, which is, during the West African crisis, we did see that the ramp up of financial resources was slow until the world kind of woke up in August of 2014, and then it skyrocketed, and money was no longer the rate limiting factor, as we sometimes. It wasn't the binding constraint in terms of mounting an effective response. I think when people look back, they said that's not the way financing should work. Right, you should have financing that is ready to go when it's needed. Of course, you should have prior investment in building up health systems. And I think there's been a lot of debate in the health community. I'm sure many of you have been involved in this directly. What is it in a world of finite resources and infinite needs? What are the right priorities? How do you invest in a health system so that you can meet immediate needs today, for example, to treat a pregnant woman with malaria, and not only to build a very sophisticated lab that may or may not be used next year, 5 years, 10 years down the line. These are very difficult decisions to make. And I think there's still a lot of effort needed, and some of it is ongoing, to develop the evidence base to inform, to guide decisions on where should we put the finite amount of money that we have today, whether that's from domestic resources or from international flows, to strengthen health systems step by step, knowing that it's not politically acceptable to have huge flows of money going into a low-income country only for preparedness when people day to day are not having their health needs met by the health system. I think that's not acceptable, and it will not be accepted. But at the same, how do you balance these two needs? I think this is an ongoing big challenge for the health and financing community. But in terms of having, for response, this, I think, relates to the earlier question around PEF. What can we do to try to have more rapid and sensitive disbursement? And I think the WHO Contingency Fund, it's a very small scale, relatively small scale. Many of the disbursements they make are under $1 million, but they are dispersing very, very quickly. So this is one instrument. It's not going to be big enough, for a major crisis, but trying to find ways of putting money into a pot so it can be spent quickly, where and when it's needed. I think it's not rocket science. Many people who are much smarter than me on financing can figure out how to do it, but we haven't done it yet. We haven't done it. Getting back to the earlier point about data sharing, what are some of the governance challenges? I think especially today in 2020, I don't think the challenges are having platforms or norms. I think it's now become quite clear that it's very important for scientists and for governments to share information quickly. And of course, it's not always easy, especially in the middle of a crisis, to gather information, to clean data, to share it quickly. These are not necessarily the first tasks that, for example, a healthcare worker is thinking about when they have a patient right in front of them. So of course, some understanding regarding delays, and maybe the data is not going to be perfect. These are all understandable. But at the same time, I do think that we need to think really hard together about how can we strengthen the incentives, because today, I think this relates a bit to the trade and travel issue. If a government feels that when I share information, I'm going to take a major economic hit, which will of course have political consequences, possibly social consequences, there's a very strong incentive to hide the existence of a new outbreak. And we've seen this for decades. This is, going back to a cholera outbreak in Peru in the 90s, for example. It's not only coronavirus China today, it's not only Ebola in West Africa 5 years ago. This is something that comes up with every major outbreak we've seen over the last, I don't know how many decades. And I'm afraid I don't have any brilliant solutions, I hope some of you do, how to better make that bargain, which is in the IHR, to make that bargain work so that we get rapid, consistent information disclosure. But I don't think we have those, neither the carrots nor the sticks are appropriately designed right now. I think that's very clear in the current outbreak.
Great, thanks for that. Any other questions at this point? Oh, we have a gentleman here in the front row. Second row.
Thank you. You said, I think, I totally agree with you, that it's time to take a step back and really look again at the IHR, not just put cosmetic touches here and there. What do you think are the main priorities for reform? The main flaws, the main things that should be changed?
The main things that need to change in the IHR. That's a great question, coming from a law professor. I don't think I have a great answer to that, and I don't think we'll be clear-headed enough, we as the broader community, to really take a hard look at that until the crisis period is over. I think one issue that has gotten a lot of attention, though, is this issue of the emergency declaration. What does it mean? What triggers that declaration? What should trigger that declaration? Is it late? Is it early? And I think that what we've seen in the 5 emergency declarations that have been made since the IHR was reformed is that it's never actually worked the way one would hope it would work. And the West African Ebola crisis, WHO was criticized, and I think rightly so, for having been late to wake up the world. And the idea then was, you need the emergency declaration as an alarm clock. If you look at what happened in coronavirus, it was quite the opposite, in that the alarm bells had been ringing already for many days, for weeks. And the purpose of an emergency declaration at that point in late January was no longer to wake up the world. The world was wide awake, as I've said in publicly before. And so the question of at that point, what is the function or the purpose of an emergency declaration? And if they are so different, the ways in which the emergency declaration is used by different DGs in different outbreaks, and the outbreaks differ dramatically, and the three criteria that the emergency committee that advises the DG is supposed to take into account in actually assessing should we have an emergency declaration. Those criteria, in my opinion, are maddeningly vague, meaning there's a lot of room for interpretation. And so it doesn't lead to a reliable system that the world can expect will be implemented in a systematic way every time. It's quite open to differences of interpretation, politics, et cetera. And so I think one of the things that Dr. Tedros has already suggested is instead of having a red light, green light system, emergency, no emergency, we need some kind of middle, yellow light. I think that certainly is something that merits consideration, but I also think there are probably a number of other questions around what does, and this really gets more fundamentally to what is the role of WHO in helping the world to prepare and respond to outbreaks, and what are the right tools we need to give WHO, whether it's the Director General or an emergency committee more broadly, to actually navigate both the political as well as a number of the technical and scientific challenges that come up. So I think there will be a lot of work for the IHR Review Committee, which is the formal committee that is put in place to review the functioning of the treaty after every single emergency. They'll have a lot of hard questions to wrestle with, but I wouldn't prejudge what the outcome of their deliberations would be.
Thank you for that question. And we have the woman in the 7th row. And we'll see how long this is. This might be the last question.
Thank you, Professor. My question would be regarding the travel restriction. How do you think are the consequences of the banned flights to and from China, and how do we deal with such consequences?
I think this relates very closely to what I was saying earlier about what are the incentives and the disincentives for governments to share information, as well as being in a context, what I would call a hyper-politicized global context right now. And as I said before, I personally I don't feel equipped. I don't think I have enough evidence or information at my fingertips to judge what is a effective or ineffective travel restriction. I wish I had a clearer view on that. But I think there are arguments to be made kind of all around. I think there's a need for consistency, though. Also, I think on the one hand, sometimes we hear people saying the travel restrictions around Wuhan, around Hubei province, have been effective in preventing further spread. And yet international travel restrictions are considered ineffective. I mean, what is the rationale behind that? And I think until we have better understanding of transmission, how it's happening, we won't actually be able to design the most scientific travel restrictions. It is very frustrating, though, and very, very difficult to make judgments on what is the right policy because of the hyper-politicized environment, of course, and many of you will be aware that the U.S. government has now, the CDC has advised all non-essential travel to all of China to stop, that Americans should not travel to China at all. And so whether this is justified or whether people even are following that is a whole other debate. But it's an area that is so fraught with both genuine uncertainty in a hyper-politicized environment. I find it hard to say one way or the other.
Great. We have 2 minutes left. Do we have time for one more question? Or do you, yeah, all right. So we'll go with the gentleman over here. That'll be the final question.
My name is Jack Riskin. I am an engineer in sanitation. I have a proposal. For me, the priority is the food safety. You have on the market in Asia and in Africa an enormous insalubrity. Everybody is eating food who is not correct, and the food is the transmission. From Pasteur, it is 1 century before, we know that the technical system permits to reduce immediately the virus and the bacteria. Why you don't use it? Why you are looking vaccination when we know that the thermic system permits to make clean market, clean food, and it's belong to the alimentary industry. Thank you for your reply.
We do not yet have a clear understanding of the exact source of the coronavirus. Of course, the leading theory currently seems to be that it originated from the seafood market in Wuhan, and it is often the case, as has been mentioned, that pathogens leap from animals, wildlife, and also domesticated animals to humans. I think it's interesting that the Chinese government has put in place a number of restrictions trying to reduce, I think, the consumption, at least, of certain kinds of wildlife. I don't know what is the state of implementation currently, but I think it's important to take a nuanced view of what's been happening, and to highlight, if we think back on avian flu, for example, if we think back on swine flu, this was not necessarily linked to wildlife. This was linked to there were wild birds also involved, but domesticated poultry in people's backyards, the pork industry in a number of places. And so I think we certainly need a lot more research to understand better where are there the greatest risks. I mean, some of the science is pointing to a few species as posing the greatest risks for being the source of pathogens that can leap to humans, with bats often being mentioned and a number of others. I do think this is an area that is worth looking into, that we need to understand more carefully, but that we also, I suppose, that there's a risk of, I think one of the risks that I didn't mention, but I think is very much a risk during the coronavirus outbreak, is a risk of exoticization and of xenophobia of people who have different practices. And so I would also want to just raise a note of caution that we are careful about that, and I think this is certainly a big risk in the current outbreak.
Great, thank you for that. And that's a very good point to end on. Do you want to mention your event coming up?
Oh, yes. Could I have the last slide? Thanks, Dan. I almost forgot about that. I just wanted to highlight that the Global Health Center will be organizing an event in exactly 2 weeks' time. So March 4th is going to be an evening event where we will be addressing, again, the coronavirus, but from a different set of angles from the one that I presented to you today, which, as I mentioned in my introduction, was probably a little bit wonky. But this event, we're very happy to have Bernard Schwartlander from WHO, Amy Chin, a correspondent from the New York Times who has been doing a lot of reporting from Wuhan, and Marcus Herman Chen, who's based in Zurich and is in the investor community, offering us, I think, some very, very different perspectives on what is currently going on, what are the implications, where are we going, and we hope to have a fourth speaker also confirmed within the next 2 weeks. So I invite you all to register, to join, and to continue the conversation. Thanks very much.
Great. Thank you very much. Well, thank you, Dr. Moon, for this. Thank you, everyone. Thank you. Bye-bye.